It's been a scene repeated across the country in the run-up to this day. Social service agencies working the phones.
Good afternoon, Northern Virginia Family Service.
And the web, trying to get people signed up for health insurance.
Well, I was expecting to qualify for some help.
They're reaching out to people like Jose Reyes, a self-employed carpenter. He hasn't had health insurance for 15 years.
This coming year, I will declare around 69,000.
That's too much to qualify for government subsidies. So after running the numbers, he found out insurance will cost him $800 a month, and he'll still have to pay the first $12,000 worth of medical expenses each year.
Sometimes I can afford it, but what happens when I don't have something to do, if I'm working with myself?
His is a story that has been repeated across the country. Coupled with a website that didn't work, the president's health care plan is not going as planned. But in his final press conference for the year, President Obama tried to point out the positive.
I now have a couple million people, maybe more, who are going to have health care on January 1st. And that is a big deal.
But that's far from where the administration said it should be by now.
Well, I think success looks like at least 7 million people having signed up by the end of March 2014.
I'm covered.
Health economists say the low number could be a big problem. Who is signing up could be another.
If all of a sudden there's only 1 million and the disproportionate are sick and older, then it's going to cause all kind of problems with respect to the balance. And in future years, the insurance companies are going to be forced to raise premiums.
Premiums that are already too high for those like Reyes.
That is the way it is. That is the way it is.
He left without signing up for health insurance, facing the choice, pay 1% of his income in a fine or fine 6% to pay for insurance. How he and millions of others decide could determine if the president's health care plan survives the year. Patty Culhane, Al Jazeera, Washington.